October 29th is World Stroke Day, and Dr. Shobha is here to talk to us about the warning signs, how to prevent a stroke, and treatment. Dr. Shobha, as always, such a pleasure to have you here on Daytime.
Good to be here.
Yeah, so a lot of people hear the word stroke a lot, but a lot of people may not know what exactly that means, what effect it has on someone's body. Can you explain that to us?
Just like when we say heart attack, that means a blocked artery to the heart that causes damage to the heart. A stroke is like a brain attack where there is lack of blood flow to the brain and part of your brain dies.
Wow.
So that is a stroke.
And so, tell me a little bit about maybe who are at risk for strokes and maybe some of the warning signs that you can look out for.
Sure. The same risk factors that cause heart attacks can also cause strokes, and these are high blood pressure, diabetes, family history. But there are different types of strokes, so let me go a little bit into the detail. One of them is called a hemorrhagic stroke or a bleed in the brain. These can be hereditary, and this is because of a burst aneurysm. And you can have a thunderclap, very severe sudden headache, and then you can have an event.
Wow.
The most common causes of stroke are what we call ischemic strokes or embolic strokes, and that can be because of a blocked artery in the neck. Sometimes you have a condition called atrial fibrillation or irregular heartbeat, and a clot can form in the heart and it can go to the brain. And so, you know, there are different types of strokes that are there. And there's some of them called small vessel disease, where the arteries in your brain are very narrow and clogged up, and that can also cause a different type of stroke.
And you even mentioned too before on the commercial break, mini strokes.
Right.
What exactly is that?
And mini strokes are so important to be aware of, and these are symptoms of a stroke that last for a few minutes to less than 24 hours, and then they go away, so people don't even realize that they have a problem. And you can have numbness and tingling on one side of the body, or weakness on one side of the body. You get suddenly dizzy, but these symptoms actually disappear on their own, and you chalk it off to something else. Oh, I'm just tired, I'm having a bad day. You know, they just blame it on different things, but they don't realize it. And people who've had strokes, when they go back and think about it, they've had these warning signs all along. They've just not paid attention.
Right.
So important to be aware of symptoms that disappear.
Right.
As well.
And so many strokes are something that can lead to a larger event?
Oh, absolutely. Absolutely.
Right.
And if you can take care of it when you have a mini stroke and identify the cause, then you can prevent the massive, devastating stroke.
Right. And so a stroke, what are some of the warning signs that people can look for?
Sure.
You mentioned tingliness and stuff like that for the mini strokes, but what about just the big events?
The big events. And you know, FAST, F-A-S-T is an acronym that we use. You know, if you have drooping on the face on one side, or if you have problems forming words, your speech is slurred, or you have a problem with the arm or the leg that is weak and not moving, these are very, very important, and these could be a sign. You know, one side of your body is kind of weak or paralyzed, not moving. That is, you know, you've had a big stroke already. You better get in there. And the T for the FAST is, you know, time. Because the earlier you get to the hospital, we have a way to treat it. The earlier you get treatment, it's better to treat it. And you call 911, you know, you let the EMS come to you, because you can get some life-saving treatment
right away.
Right away, and they can prepare the center where they're taking you to. Because if you are there within 4 to 6 hours, there are certain therapies that you can get right away, like clot buster medicine. Sometimes you can put a little tube into the artery of the brain and suck the clot out, or and you know, you completely recover.
Wow.
Otherwise, you know, once the brain is damaged, unfortunately, just like the heart muscle, it does not recover. It's permanent damage, and you know, you're paralyzed for the rest of your life. So you want to prevent that at all costs.
Right. So FAST is a great acronym that people can always keep in the back of your mind: face, arm, speech, and time.
Correct. And the one other thing is dizziness. Sudden onset of dizziness with a lot of nausea can be a stroke to the back of the brain. And sometimes people will have stroke just in the eye, you know, where the sudden loss of vision in the eye. So there are other, you know, smaller things that also you need to be aware of.
All right. Well, Dr. Shobha, thank you so much. We could talk about this all day. Some really important information that all of our viewers appreciate. Thank you so much for coming in.
Thank you.
And make sure October 29th is World Stroke Day. So think about those warning signs and be aware of your body. All right, Dr. Shobha, thanks so much. We'll be right back.